So, hello everyone, my name is Prajwol Shahi, and in this presentation, I will be explaining my project called Medhome, which is a digital healthcare application designed for Nepal. So, in this group, we've got me, Prajwol Shahi, Ishan, Govinda, Joshi, Prabhash Sigdel, and Saugat Neupane, and our module leader is Raj Lama, sir, Mr. Raj Lama. This is project for our Be Your Own Boss module. So, healthcare management in Nepal is still highly fragmented. Many hospital stores medical records only in physical file, and doctor appointments are often arranged through phones, calls, or walk-ins. And emergency information is rarely available when it is needed most. Like documents are only available and emergency visits are only available, emergency wards are only visitable when it's an emergency. So because of this, patients often struggle to keep track of their medical histories. Doctors sometimes make decisions without complete information, like they have to make decisions uh, without information in hurry. So uh, and people living in semi-urban areas or rural areas, villages, face even greater difficulties accessing healthcare services. To solve these challenges, the idea behind Medhome is to create a single mobile platform that integrates multiple health services in one place. The goal is to simplify how people store, access, and manage their health information while also helping doctors and health providers deliver fast and better care. So, what is Made Home? Let's start with the summary or introduction. Let's start with the introduction. So, Made Home is an all in one mobile health application designed to digitalize and organize personal health management. Platform allow users to store medical records, books, doctor appointment, order medicines online, coordinate blood donations, and access emergency health information. One key feature is digital health password. The digital health passport stores QR, generates QR that stores important information such as blood type, allergies, vaccination histories, and emergency contacts. In emergency situations, like if you've got some accidents, health provider can simply scan the QR code and instantly access the vital information which are required obviously um, for your uh, emergency contacts or for your emergencies. In an emergency situation, healthcare provider can simply scan the QR. That's it. So the platform is designed for three main groups of user. First, the patients who want easier and faster access to healthcare service, like important business persons who cannot visit doctors frequently. Second, doctors who need tools to manage appointment, review patient records, and provide consultations. Third, administrations who want medicine stocks, platform operations, and overall system monitoring. So let's go towards the mission and vision. The mission of MedHome is to make healthcare management easier and more accessible through technologies. So the platform aims to bring together different health services into one simple mobile applications where user can store their records, consult doctors, and access their digital password anytime. So this application is mainly focused for people which are specially abled, those who cannot visit doctors frequently. So by doing this, Medhome hopes to empower people across Nepal, including those in remote areas, to manage their health confidently and make better healthcare decisions. By saying that, it's not only for people who live in rural areas, it's not only for them. Yes, it is difficult for them to access healthcare services, but also including the specially abled people and important business persons um, who cannot frequently visit hospital for routine checkups. The vision of Medon is simply to become a nationwide digital healthcare ecosystem where people can instantly access their health information and communicate with healthcare professions anytime from anywhere. That's it. It's simple. So let's go towards the objective. To achieve this vision, Medom has several keys opportunities. So first, to develop a reliable mobile platform that can handle large amount of efficient user efficiently. Second, to integrate multiple healthcare services such as Medom records, doctor appointments, medicine deliveries, and emergency health data into one system. Third, to create a secure digital health password using QR code that allows instant access to essential patient information during the emergencies. Another important objective is that to collaborate with hospital, pharmacies, clinics, and healthcare specialists so users can access a wide network of services. Finally, the platform aims to expand in the future by adding advanced features such as predictive health analytics and chronic disease management tools. Also, this healthcare application has got chatbot which can be used by the user uh, to diagnose simple symptoms. So let's go towards the problem in current healthcare system. The main problem Medhome addresses is not necessarily the lack of healthcare services in Nepal, but the lack of integration uh, and accessibility. So the integration and accessibility is main focus of this application. Medical records are usually stored in physical folders across different hospitals, which are not able to which are not which doctors are not able to access, or patients are not able to access remotely, or even they are not able to take those records physically, which they may forget, or there may come a different problem. And appointments are usually scheduled through phone calls or walk-ins, which can be inconvenient and time consuming, obviously, for this era where people say time is money. It may be inconvenient. Sorry for my stutters. I'm reading my script, and also I'm creating uh, my own presentation, so I may stutter a little bit. So medicine purchase also require visiting pharmacies, and also it may not be convenient for people to order through different application like InDrive, um, and Pothao, etc. So everything is integrated in this application. These issues can create several consequences. Patient delay seeking care because the process is inconvenient. Doctors sometimes make decisions based on incomplete medical informations, so the informations may not be complete. Medication schedules are not followed properly, and emergency situations become more difficult because vital health data is not immediately available. Like example, for your blood group is not available, and you may not be able to say that your blood group is this. Let us suppose if you are in accident, or if you have faced something, you may not be able to tell people that your blood group is this or your emergency contact is this. In this case, the QR system comes in handy. For people living outside the major cities, the situation is even more challenging due to limited access to specialists and healthcare facilities. So let's go towards the solution. Medom solves these issues by creating an integrated digital healthcare system or platform. Through the mobile application, user can securely store their medical records, obviously, which can be verified by your doctors or the systems administrations. Okay, the platform maintains a health timeline, allowing users to track their medical histories over time. One of the most important components in this digital health passport, which contains key information such as blood type, allergies, vaccination, and emergency contacts, which may come in handy in important situations, obviously. Another feature is online medical medicine ordering, where users can order medicines. Obviously, I've said you again that there are different platforms, online platforms, which from which we can order um, medicines, like example Patao, or in drive, but it may not be convenient enough. So user can search doctor, book appointment, and attend virtual consultations with both local and international specialists. The platform also includes a blood donor coordination ecosystem, where donors can be filtered based on blood group and location, and also it can be filtered if it's an emergency or not. Additionally, Medom includes an AI health chatbot that can answer health questions and assist users with booking services. So let's go with market assessment. So the digital health sector in Nepal is growing rapidly. According to the market research, digital health market is expected to reach approximately 90 million US dollar in 2025 and grow continuously in the upcoming years. Mobile internet penetrate in Nepal has exceeded 95%, where 95% of the users, 95% of the Nepalese use have got access to smartphones and mobile internet. The main target of Made Home is urban and semi-urban smartphone users, and also those users who are specially abled, and people, business persons who cannot hire their personal doctors. This represents a potential market of around 3 to 4 million users. So let's go towards the revenue model. Medom users uses a freemium business model. Where is the revenue? Let me go and yeah. Let's go towards the revenue model. Where is the revenue model? Let's go on content. Let's go towards the revenue model. Medom uses a freemium business model. Basic features such as health record storage and the digital health password are free, so that everyone can access the platform. Revenue will be generated through several streams. First, a commission from medicine delivery. So, the commission is 5 to 10% per order. Second, a small fee for appointment booking made through the application, which is also 5 to 10% per order. Third, commission from health packages and medicine service offered through the platform. So, it is also 5 to 10% per health packages or medicine service. So, let's go towards the risk factors, risks, and challenges. Despite its potential, Medom faces several challenges. One major challenge is digital literacy, as some users may not be familiar with digital health platforms. Another challenge is data security and privacy, since handling medicinal informations required strong protection and compliances with healthcare regulations. Sorry for my stutter. I've not spoken this much uh, yeah, in a long time, so I may stutter a little bit more. Another challenges are data security and privacy, since handling medicine information requires strong protection and compliances with healthcare regulations. There may also be resistance from some doctors who are used to traditional healthcare systems, like doctors who are not able to use smartphones. These are the potential risk factors. Additionally, infrastructure limitations such as poor internet connectivity and outage could also affect online consultation and digital services. So let's move towards the conclusion. In conclusion, Medom application is designed to transform how healthcare services are accessed and managed in Nepal by integrating medicinal reports, doctor consultation, medicine delivery, blood donation, coordination, and emergency health data into one platform. Medhome aims to simplify the entire healthcare journey for patients. The platform also helps doctor management manage patients' information more efficiently and enables faster medicine decision making. With the growth of adaptation of smartphone and digital technologies in Nepal, Medom has potential to become a powerful digital healthcare ecosystem. Ultimately, the goal is to empower Nepalese citizens with better tools, information, and connections so they can make faster so they can make everything faster and more informed healthcare decision. Thank you for listening.